Today we are going to learn about the side-loading aspirating syringe. It is California law that we use a side-loading aspirating syringe, which allows the doctor to aspirate or pull back to check for blood. If there is blood, they are in the vein and needs to try again to get the nerve. If the doctor misses the nerve and injects into the vein, it will cause a hematoma, which is localized swelling, filling with blood, or a bruise. It can alter the vital organs if the doctor continues to inject. The parts of the syringe are the threaded tip, the barrel, the harpoon, the finger rest, and the bowl, thumb ring or plunger or plugger. Okay, thumb ring, plunger, or plugger. Next, we're going to go on to the carpule or cartridge. We have the rubber diaphragm, the aluminum cap, the rubber stopper. Things we need to look for on the carpule are names of the medication, expiration date, cracks, debris, puncture marks, bubbles, corrosion, location of the rubber stopper. If it's protruding out, the carpule has been frozen in probably being transported to us from another state. If it's protruding in, it's been used. Also discoloration. And the most important thing we need to look for is whether or not it contains epinephrine. Epinephrine is a vasoconstrictor used to constrict the blood vessels to prolong the effects of the anesthetic by decreasing flow in the immediate area of injection. It also decreases bleeding, which makes it easier for the doctor to work if there's not a lot of blood at the surgical site. We need to check the number. So this one is lidocaine with epinephrine, and it is 1 in 50,000. That means the lower this number to the 1, the stronger or more epinephrine it contains versus 1 in 100,000. Next, we're going to go on to the needle, which is, I do apologize. Next, we're going to name the types of anesthetics we're going to use. Here in this classroom, we have Citinus, lidocaine, carbocaine, polocaine, ravocaine, or xylocaine. Okay. Next, we have the needle. We have our protective cap, which is this clear one, our needle guard, which is the color. We have the hub, which is this portion here, the bevel angled tip, which allows us to penetrate the tissue easier. We have the hollow portion of the needle, which is called the lumen, which allows the medication to flow through the needle. And we have the different gauges of the needle, meaning the thickness. So the 25 is red, the 27 is yellow, and the 30 is blue. The smaller the number, the thicker the needle. Okay, we also have 2 different lengths of needles. We have our 1 inch, used for maxillary infiltration, and the topical is placed at the apex of the tooth we're working on in the mucobuccal fold. We also have the long needle, which is 1 5/8 inch. It's used for a mandibular block. The topical is placed on the lingual side of the ascending ramus over the mandibular foramen. The injection is given into the mandibular foramen, which gives us access to the trigeminal nerve. The trigeminal nerve is the 5th cranial nerve out of 12, and it contains 3 branches, which are thalamic, maxillary, and mandibular divisions. The medication tends to pool at the semilunar ganglion, and that means you can get kind of numb in all 3 of those branches, but primarily you're going to be numb in the mandibular division. However, let's say the doctor needs to work on tooth number 25 and it didn't quite get numb. We can give a booster injection in the mental foramen, which is located in the chin, or the apex of the tooth we are working on. Next, we would load our syringe. So you're going to have all your safeties on. You're going to place the carpule in. Going to give it a couple of taps. We're going to remove our protective cap. Do our prayer hands to thread the needle into the threaded tip with the hub. I apologize. And we're going to get that on. And then we're going to rock gently to loosen the cap. So when we pass to the doctor, the cap comes off very easily without any pullback. This is the body or the shaft of the needle, if I did not mention that earlier. Next, we're going to recap the needle using a scoop technique. So one-handed technique, or you can use a recapping device such as this here. You would place the cap in. So when we take this end off, we can place that in there and recap safely without coming in contact with the needle at all. We'll remove our carpio and we'll place these two into our sharps container, and this would go to sterilization to be sterilized along with this. These can both be sterilized in the autoclave. Thank you. Hope this helps.